Great, thank you. This has been a truly great discussion. We have reviewed a lot of information on updates in ovarian and cervical cancers. To close, I'd like to get final thoughts from each of our panelists. Mike, start with you.
I think it's a extremely exciting time for the drug discovery and treatment of these tumors, mostly because of the new molecular data that we were able to obtain. And we need to translate that into the clinic with new and novel targets. And at a very minimum, we should be able to convert some of these diseases from being highly lethal into chronic diseases. But certainly the possibility is we could cure more patients.
Bob, you're next.
I have a combination of two thoughts, and they go together, but I think that the focus at least in the United States and really worldwide should more heavily emphasize research on prevention. And we have so many opportunities with what we know already right now to make a difference in terms of prevention of ovarian cancer as well as cervix cancer, and we could be doing a better job. And I think that from a public healthcare policy standpoint, we really need to do a better job in funding that area. And it's very difficult because it's not always driven by industry support. And that's why we really need the community at large to back us in that area.
Warner?
Yeah, I mean, I think that arguably, I think probably some of the most substantial changes in management have occurred in GYN malignancies in the last 10 years. And to echo what Bob said, I would love to see cervical cancer go away. And I think with screening prevention, we have basically the scientific and clinical burden of proof to demonstrate that that can happen in reality. We just have some issues related to vaccination and access to screening. There are continued problems. When it comes to ovarian cancer, there's no doubt in my mind, and we were having this debate within our own division recently, that in the next 5 years, I think we're going to be managing ovarian cancer very differently and under a different mindset than we did 5 years ago. And I think it's kind of gratifying because I think that the research has really markedly changed the landscape from top down, from treatment all the way down to screening. So I think it's going to be a very different world 5 years from now.
And as always, the last word, Tate.
But on a little bit different tact, I think the biggest challenge that we have ahead of us is to develop new clinical trial approaches that enable us to continue to make progress. An example of the kind of snag that you run into with success is our current debates over the proper endpoint for an ovarian cancer trial, where we have clear evidence that bevacizumab works, but we have no regulatory approval because the regulatory agencies want overall survival improvement, which is virtually impossible in a setting where you're giving 8 to 10 additional lines of therapy after the initial trial. So I think that those of us involved in the clinical trial area are going to have to be creative and to work hand in glove with the regulatory agencies to develop ways in which we can demonstrate the efficacy of our therapies effectively and in a timely fashion. And that may be the biggest challenge that faces us in all of this.
Thank you. On behalf of our panel, we thank you for joining us, and we hope you found this peer exchange discussion to be useful and informative.